Let's welcome the Honorable Chief Guest of the CSR Awards ceremony, Shri Rao Inderjeet Singh Ji, the Honorable Minister of State for Corporate Affairs and the Minister of State for Statistics and Program Implementation. May I request you, sir, to please grace the dais. Inviting Shri C.K. Mishra Ji, our esteemed jury chairman and the former Secretary Health and Environment, Forest and Climate Change. The session lead, Shri Daljit Singh Ji, past President Nathealth and the former President of Fortis Healthcare. Shri Ashwajit Singh, Nathealth North Region Chair and Founder and Managing Director, IPE Global Group. And Shri Siddharth Bhattacharya, Secretary General, Nathealth. And may I request our session lead, Shri Daljit Singh Ji, to please welcome the Honorable Minister by presenting him a bouquet. Ladies and gentlemen, please join us as we extend our good greetings to the Honorable Minister, thanking him to be our chief guest for this very important ceremony as we present the Healthcare CSR Awards. And now I would like to request and invite Shri Daljit Singh Ji for his welcome remarks.
Good afternoon, ladies and gentlemen. It's my proud privilege on behalf of Nathealth, on behalf of all of you present here, to accord a very warm welcome to our chief guest today, the Honorable Minister, Shri Rao Inderjeet Singh, who's here with us today. The Minister, as you know, he's a Union Minister, independent in charge of the Ministry of Planning and Programs, Union Minister of State, independent in charge for the Ministry of Planning, and he's also the Union Minister of State for Corporate Affairs. An alumnus of Lawrence School, Sonar, the Hindu College and the Law Faculty, Delhi University, Mr. Rao Inderjeet Singh Ji he's led a very, very illustrious career, and he has many, many accolades to his credit. In public service, he has been on the Haryana Vidhan Sabha for 4 terms, spanning a period of about 20 years. His current role as a Member of Parliament, this is the 5th term as a Member of Parliament. And there are several ministries that he's actually headed as part of his very, very illustrious career. The Honorable Minister has not just been in public service, but has a very wide dimension to whatever he does. He's been an outstanding sportsman. For some of you who may not know, but he was the national champion for skeet, in the skeet discipline of shooting for 3 years. He has won the bronze medal at the Commonwealth Games for shooting. He's won 3 gold medals at the South Asian Federation Games. So that's the honorable gentleman that we are felicitating here today. And he will be presiding over these very prestigious CSR awards, and we'll be sharing a lot of details with him during the course of the session. I also have great pleasure in welcoming amongst our midst another very familiar face, Mr. C.K. Mishra, who was the former Secretary, Government of India, and many of us in the healthcare domain have known him very well because we've interacted with him. He was in charge of health at the national level. He is also currently the mentor for the Swasth Bharat Task Force for FICCI. And he's headed the jury which has evaluated all the entries for the CSR awards, which are much sought after now. So welcome to our midst, sir. And finally, I would like to also welcome Ashwajit Singh, Mr. Ashwajit Singh, who's the founder, managing director of IPE Global Group. He also happens to be a very active member of Nathealth and chairs the Northern Regional Council. Mr. Ashwajit Singh and his organization have been the implementation partners for a very prestigious project that was the initiative of Nathealth called winning with vaccines. And he's also been the thought leadership partner, his organization, for the CSR awards that we have. And finally, I would like to also welcome our illustrious Secretary General of Nathealth, Siddharth Bhattacharya. I want to say a bit about what we're going to be doing today. So there are two aspects to this get-together today. One is to talk about the Nathealth's initiative, CSR initiative that Nathealth took in response to the COVID pandemic that took place. There was a huge challenge. There were certain districts in our country where there was a lot of resistance to vaccinations, as happens in a massive country like ours. And we identified 5 such districts in the state of Assam and 1 district, Nu, in Haryana. And took that up as a project that we needed to implement, that we need to be able to bring about behavioral change in the way people look at vaccines, and through a process of reasoning, through a process of communication, enable them to voluntarily come forward and make this vaccine project a success. And that entire project of implementing it was headed by the IPE Center for Knowledge and Development, which is headed by Ashwajit Singh, and he'll be sharing a lot more about it as we go along. It was a very successful project that was run, and we are extremely proud of the way it's panned out, because there are a lot of lessons for us. It offers an opportunity for us to scale up at the national scale to resolve such issues that may crop up in our big country. The second aspect of today's are the CSR awards. And the CSR awards were initiated by Nathealth to really focus on a couple of things. The first was that it was found that organizations did a lot of CSR work, but the effort was fragmented. Through the initiative of Nathealth, a lot of this effort has been directed towards bringing about improvement in the health status of our citizens of our country, and therefore to focus attention only in the domain of healthcare. And there have been a number of categories that have been outlined in the applications, and you'll hear more about that from the chairman of the jury. So there will be a video which will be played that will talk about our Win the Vaccines program, and there's going to be a table book launch which we'll do as part of this proceeding. So without any further delay, I'd like to call upon Mr. Ashwajit Singh to come forward and take us through this wonderful project, show us the video, as well as steer the book launch.
Honorable Minister Rao Inderjit Singh Ji, Mr. C.K. Mishra, Daljit Ji, Mr. Siddharth Bhattacharya, esteemed colleagues, delegates, participants, awardees. I mean, I can see a room full of very eminent people. Probably the entire health sector is very well represented right now as we talk. Let me start by a quotation which has always been one of my favorite quotations. When God blesses you financially, don't raise your standard of living, raise your standard of giving. And I think that's what CSR is all about. That's what the ethos and philosophy of CSR is. I'm here to talk about a very unique project which Nathealth has initiated. It's the first CSR project of Nathealth called Win with Vaccine. It's very unique in a number of ways, because whenever we talk about CSR and we talk about the normal sort of feeling that CSR is really done by companies in the form of either staff welfare or looking at where their plants, etc. are. But this particular project is very unique and different, because Nathealth is an independent and neutral platform that has allowed like-minded corporates to leverage their resources, collaborate, and align their objectives to achieve high impact. So it's really a partnership of 3 funders, We've actually got the GE Healthcare, the Sharnock Hospital, and the Fresenius Medical Care, which have collaborated and funded Nathealth to implement this unique project. So it's a neutral project, independently run by the Federation itself. The project has been implemented by the Center for Knowledge and Development. Seema and her team has implemented it. And it was a small project, a 3-month project, but a very unique project because it focused on behavior change communication campaign, working very closely with communities, with government, with all the private sector players. It was really looking at implementing in hard-to-reach, flood-prone remote geographies, where there was a high resistance to vaccination. They interacted with the district governments and immunization offices and identified 4 districts in Assam, the Buxa, Chirang, South Salmara and Udaiguri, and Nu in Haryana. The interesting part is that the communities in these districts were indigenous tribes like the Bodos, Rabas, the most orthodox Muslims who are, I mean, we've seen you'll see in the film and otherwise as well, and other religious minorities. There were people who were absolutely against getting vaccinated. They were the left out and drop out communities. And it was very difficult because if the government of India had to be as successful as we have been, you would need to cover everybody, the entire population, especially the communities which were resisting vaccination. The team first went there and engaged with all levels of society there, right from the community to the teachers to the policy makers, influencers, government, and tried to understand the barriers to vaccination. And then used a very wide mechanism of behavior change communication. They actually went in for a number of innovative things like, nukkad plays, posters, talking to teachers, presentations. So it was a very detailed on-the-field work that they did. They were able to have a campaign around full vaccination, full protection, and they were able to do it in a bilingual manner. They were able to do it in Assamese, Bengali, Hindi, Bodo, and English. And over 2 lakh people were actually impacted by this particular initiative. You will see in the film that the impact was huge. 2 lakh people were sensitized. More than 50 plus stakeholders were engaged. 111 community consultations took place. They had 25 vaccination camps and used multiple tools, right from nukkad nartaks to wall paintings to banners to village miking. They went and identified the influencers, be it the Tauji in Haryana or the Ahumi Bedoi from Assam, and they inspired confidence from them and then asked them to also pass on the message. They used radio jingles, local language, so a lot of work was done and had a huge impact in encouraging to go and break the barrier or the myth of vaccination and get vaccinated. So I think the important lessons that we learned, because of time I'll just keep it short. One, of course, is that it's important to involve the community from the very start. So that is what was done, because whenever we talk of any CSR project or any implementation at the ground level, it has to be bottom up. You can't come in and say the government has said get vaccinated, so you have to. You have to really involve the community at every stage, use local resources, get them engaged. The other important lesson, of course, was that involve multi-level stakeholder involvement is required. So whether it's the government has to be engaged, because if you have to sustain the initiative, the government's role is very important. The community, teachers, influencers, private sector. And of course, customize the behavior change communication. You can't, one thing can't fit all. So you really need to customize, get engaged, understand their local needs, local languages, local issues that impact them. And I think another important message here is that if you're really looking at making a huge impact in CSR, it's important to leverage resources. Here we had 3 entities which came together to leverage their resources, and probably they achieved more result than they would have if each one of them had tried to do it individually. And the important issue is that they had aligned objectives. The 3 funders had aligned objectives, and the objectives were also aligned with the government of India and the state government's objectives. And of course, a platform like Nathealth, I was very pleased to see that Nathealth as a federation is one of the first to come in and say, look, we are a neutral platform. This is a model that can be replicated. More entities can come in. more members, non-members, be it any PSUs, government, private sector can come in and scale this up for us. So I think it's been a huge success, this program, and I'd like to particularly thank the three funders. I'd like to thank, of course, the Nathealth team, Siddharth and Anvisha were there, the Center for Knowledge and Development of IP, you had Seema Gupta, Sukriti, Shreya, Shavi and Praveen. So all of them have really worked hard and made this a huge success. So thank you all once again, and thank you Nathealth, and thank you the funders for participating in this. We'll now show you a small film which would give you the impact of the project and how we went around it.
Win with Vaccines is an incredible story of behavior change amongst the left out, dropout and resistant communities. The project witnessed a shift of resistance to a gradual acceptance of the COVID-19 vaccination. The key beneficiaries were indigenous tribes and religious minorities from remote, hard-to-reach geographies, most of whom have been historically marginalized and are traditionally resistant to vaccination. Win with Vaccines set out to understand the myths, misconceptions, and barriers towards COVID-19 vaccination, and a contextualized behavior change communication campaign was designed with the support of government and community engagement.
After the passage of the second wave, people slowly got a bit reluctant and hesitant towards COVID vaccination. They had some phobias, they had some myths about the vaccine. The team from this organization, they have very well explained the people and committee as such about the benefits of COVID vaccination, and they have also tried to resolve and remove the myths prevalent in the society.
Locally respected leaders like Tauji from Haryana and Ohomi Baidio from Assam inspired the development of the mascots who carried the message of full vaccination, full protection in Assamese, Bengali, Hindi, Bodo and English. The campaign curated messages for various subgroups like school-going children, pregnant women and the elderly. Over 2 lakh people were sensitized via a communication burst of messaging through multiple channels of communication like posters, flyers, wall paintings, street plays, miking, radio jingles, and WhatsApp messages were developed to disseminate information, and local talent groups were used.
CKD टीम, पूरी टीम यहाँ पर आई हुई थी और बच्चों को उन्होंने बहुत ही प्रोत्साहित किया था टीके लगवाने के लिए।
আৰু তেখেতসকলৰ বিভিন্ন আঁচনি যেনে ধৰক ৱাল পোষ্টাৰিঙে হওক বা সজাগতা সভাই হওক আমাৰ মাজত এটা এৱাৰনেছ আনি দিলে।
महकमा सेहत की हेल्थ डिपार्टमेंट की पूरी तरीक़ा से मदद करते हुए सरकार की गाइडलाइन के मुताबिक हमने वैक्सीनेशन का प्रोग्राम आगे बढ़वाया।
আমাৰ গাঁৱত আমি বহুত কোভিড ভেকচিনৰ কাম কৰিলোঁ, মানুহবিলাকক মাতিলোঁ, PHCতো ভেকচিন দিয়ালোঁ, গাঁৱতো গ'লোঁ।
The approach of the project was to work closely with community influencers like Ashas, ANMs, Anganwadi workers, school principals, village heads, and tribal and religious leaders as the key influencers who provided quick access to the community and ensured acceptance of the project. Win with Vaccines mantra of full vaccination, full protection, Pura vaccination, Puri hifazat still echoes across every household, health centers, schools and community meetings.
हम सबकी इबादत, पूरा वैक्सीनेशन पूरी हिफाजत, पूरा वैक्सीनेशन पूरी हिफाजत।
Thank you. I think a round of applause for Nathealth, the funders, and of course the team that worked on the ground. Thank you so much. I'd now like to request the Honorable Minister to release the coffee table book, but I'd like to also invite representatives of GE Healthcare, Sharnak Hospital, Fresenius, and of course Seema from CKD and Anvisha from Nathealth, who were involved in making all this happen. I think we have Chaitanya from GE, Prashant from Sharnak, and Praveen from Fresenius. Would any of the partners please like to say a few words on how they decided to get involved, and please come.
Good afternoon. Namaskar, sir. Sir, this was a very noble initiative and headed by Nathealth. I think they roped in all the players. However, there are a few things which, apart from this event, if I may put to your kind attention. Sir, we are aware that the CSR, being a mandated rule by the government, is what is encouraging most companies to come forward and contribute a certain amount. If not done, then it is diverted to a certain Prime Minister fund. May I request, sir, that out of this spending, if there can be a budgeted allocation for two very key important sectors for the country. We all know that health and education are the two very key important sectors of the country. If we can have a 20% or 10% allocation for health out of the CSR spend, that would really see the money going to the relevant respective places where it is very, very important for that money to be reached and to be utilized properly. Many platforms like Nathealth and their allied associates can utilize that, but if this is mandated, it will see a revolutionization change in the implementation of the much required steps to be taken. Thank you.
As a representative from GE Healthcare, we were very happy to be associated with Nathealth and the other institutions in ensuring that awareness of COVID vaccine is something that we are able to perpetuate across the regions which were less prone to it or less aware of it. And I think to the earlier commenter, I would say that wholeheartedly agree that I think the CSR initiative and the need to direct more resources towards health and education might be a good way to be able to bring out change in the healthcare industry overall. So with that, thank you very much to Nathealth and to the other partners that were involved. Thank you.
So I'm Parveen from Fresenius Medical Care with the two other funders. I think it was also our great pleasure to be part of this journey. I can honestly say I think this was one of the very quickest decisions we have been able to make. Although this was the first in time Nathealth was doing it, but under the umbrella of Nathealth, I think we have the full confidence that the money which we will utilize for this CSR will go in the right hand and will be utilized for the best purpose. As we see the impact, I think we say it's a 2 lakh population, but I would say it's more than 2 lakh because it's not just the current people which we have impacted, but they are now the brand ambassador. And I'm sure, of course, we have reached a very good milestone in the vaccination rate. Going forward, I would also see, I think this encouragement will continue. Once again, thank you so much from Fresenius Medical Care to take us along with this journey.
Thank you so much once again for your support. And so I think in addition to the ask they've had, probably I would only like to make one suggestion that, federations like Nathealth, which are independent, there is otherwise a 3-year requirement before they can apply for FCRA. Now maybe like you have for the institutes like the IIT and some of the institutes of excellence, maybe the government could consider that federations, independent federations like Nathealth could have an exemption on the FCRA eligibility, and they could be allowed to get that earlier, because then that will only encourage, we're talking about say GE for instance, that could encourage GE International to also sort of come in and support CSR projects. So you will only sort of hopefully get more funds from overseas in addition to, of course, corporates in India funding. So maybe that's something you could consider. Thank you for the first part and your indulgence in the Nathealth initiative. Now I'll quickly move on to the second part, which is the CSR awards of Nathealth. Mr. C.K. Mishra, the chairman of the jury, is here, and we've also got Dr. Sheena Chabra, who's with the World Bank and member of the juries. The other jury members are not here, but just to let you know that we had a very, very powerful and independent jury chaired by Mr. C.K. Mishra, who's of course the former Secretary Government of India and both in health and environment. So when you talk about the convergence between health and environment, nobody in the country knows that better than him. We had Dr. Indu Bhushan, the ex-Secretary Government of India and the CEO of Ayushman Bharat. We had Mrs. Roli Singh, who's the Additional Secretary and Mission Director of the National Health Mission, Government of India. We had Dr. Rajni Ved, the Director Health of the India Office, Bill and Melinda Gates. Mrs. Sheena Chabra, Senior Health Specialist, Global Practice of the World Bank. And Dr. Sampati Guha, Professor of the Tata Institute of Social Sciences. We had a number of meetings, and I'm pleased to say that the entire panel actually participated in the meetings, and we had record entries. More will be told to you by Mr. C.K. Mishra. Can I request Mr. C.K. Mishra to please take over and talk about the jury and the awards?
Thank you, Ashwajit. Honorable Minister, ladies and gentlemen, it's such a delight to be here before so many known faces and known personalities who you have worked with at some stage in the past. And also a huge, as they say, feel-good factor to be present in Nathealth proceedings right from the beginning till today. And let me tell you that this organization has grown and has grown very well and really represents what it intends to. So congratulations, Nathealth, for this. Now coming back to the awards, I mean, it's never easy to judge excellence, particularly when you have several excellent pieces on the board. You really can't make out or say which is what. But you have to have a calculation, you have to have a methodology by which you decide who's been a little better than the other. To begin with, let me just share my views. You know, we all think and claim that when you are judging, you're judging because you know everything. When I went through the kind of work that was done by the organizations who had applied, I realized that judging an event really means knowing how much there is to know. It's a huge learning experience and really tells you what all is happening all across India. And to that end, I must congratulate each and every one of the applicants. I mean, thank you, Nathealth, for organizing this, and thank you for starting this CSR event. You know, in government, and I'm sharing this very frankly with you, I always thought that for the corporates, CSR was another box ticked. Percentage over, work done. This is for the first time that I really saw that there is an effort to contribute to excellence and contribute to reach. That's a great, great thing happening. Many suggestions came just before I started on how to use the CSR funds. I have been a votary of the fact for a long time that we need a national level effort to pool in resources, talents and ideas of CSR to actually make it work in a much more effective manner. How you do it, how you structure it, whether it's a trust, it's through budget, how it comes is a different story. But it needs to come. Fragmented efforts will have impact, but if you want real good impact, it has to be a joint effort. So pooling of resources, according to me, is a very, very critical thing. You know, it's been a very enriching experience, and I don't know whether I have graduated or the age is catching up, that I have moved away from speaking in Nathealth seminars to judging events. But it was a unique experience, I must say that. And there were really three things that caught my attention while I was going through the entire thing. The first is the overwhelming response itself, the number of applications. See, for years and years together, there are organizations which are doing an extremely good job in the field. But if you look at the kind of convergence at the level of awards, and Dr. Puri is here, he'll bear me out when we do the FICCI awards, people don't come to you to stake claims for the award. So there's a lot of good work which is done but left there. It's very good sign that people have started signing up for these applications and coming forward to say that there was a work done. It's not just about award. The fact that they come forward and tell you about their event, about their work, it opens up a huge vista for everybody else to actually learn from that, replicate and do a good work themselves. So it's a very good thing. The second thing is the kind of reach that the work that the applicants have been doing, the organizations have been doing. And reach is not just in terms of the lives you touch. It goes beyond that. It goes into technology, it goes into every sphere. And the third is it was after a long time we feel that there is an attempt to address quality. In Indian healthcare system, I strongly believe that we've managed the access, but we've not yet touched quality. And we need to do that very strongly. So, just to give you a flavor of the process, it was a tough one, and a tough one in the sense that there were several rounds. And I'll quickly go through that. There were applications, the jury got together to decide what weightages would be given, what would be the criteria for judgment and shortlisting. Then the CKD people got together, sat and shortlisted from the 63 applications to about 20 odd in various categories. Then the jury met again. After having individually reviewed all the 63 applications individually, the jury members met again to look at these shortlisted applications. And there was intense to and fro in terms of who agreed, who disagreed. But in the end, merit is something that everybody agrees to. So we had a common kind of a thing, unanimous say, and I guess that will be presented very soon. And some of the figures that were provided to me by Seema from CKD is quite encouraging. 63 applications. If you break it down, the interesting thing is that 40 of them are in community health. So, in a way, when one would say there are 40, but if you look at it very deeply, there's something happening on the ground. Something seems to be happening in tier 2, tier 3 cities and in the villages. And that is what we would like to happen. I mean, tertiary care will grow, technology will come, take them ahead. It's that connect which is critical, and I'm very happy that there are 40 applications in that. Which means that slowly is becoming a priority, not just of government and public spend, but also of private effort. And what a beautiful thing it will be if there is a convergence of the two. In fact, I am desperate for that day when we'll see a unique convergence of the private and public effort in terms of reaching out to people. And these were applications by both the CSR donors and also the implementers. So it is a good combination. Another figure that is very revealing is that each of these organizations on an average touched 2.75 lakh lives. Staggering amount when you do a total. And staggering amount when you do a total of those who applied. Just think of the kind of work that is happening. And that brings me to my favorite point. Is somebody sitting at one particular place trying to aggregate all this? Trying to get the best out of it and have it implemented in a way that it should be through public effort. So, congratulations to all the winners who you will get to know. In a society where celebration of success is not a top priority, or not even a priority actually, it's great to recognize good effort. Because I strongly believe that it is only by celebrating success will you be able to replicate success and get far more out of it than what you have. So I think we need to get out of our old thought of being cynical and critical about everything, pick up these sparks, celebrate their success, and let others follow. That is what will lead to the multiplication of this. All the winners are, of course, very worthy of this award. We have limited the numbers. In fact, in one of the categories, we decided not to give an award because most of the applications were very routine. This is just to tell you all that we have made sure that only those who are different, innovative, and have made a good impact have been selected for these awards. I was in fact very surprised that when we were not able to award anyone from the digital health technology segment, because most of them were what is happening for years. And I'm sure there's a lot more happening in the field, many innovations, many startups doing many more things. Hopefully we'll get those applications very soon. And, we will be able to move on. So to end, thank you very much to my jury members who really slogged to read those 63 applications in the Excel sheet, which would perhaps fill this room. There's so much of information and input. But they went through it and they really spent a lot of time, all of them very busy people, but they set aside time for this. So thank you very much. And thank you, CKD, Nathealth, for doing this. And I hope as we move ahead, CSR becomes a critical enabler for change in how we deliver healthcare in future. Thank you very much, ladies and gentlemen.
Thank you very much, sir, for your very motivating, inspiring, and guiding observations on the various nominations which were received. Thank you, sir. और देवी सज्जनों, इन पुरस्कारों को यहाँ पर प्रदान करने से पहले और इससे पहले कि मैं माननीय मंत्री जी को आमंत्रित करूँ, दलजीत सिंह जी ने माननीय मंत्री जी के बारे में हमें बताया, पर मैं आपको ये बताना चाहूँगी कि आज, जैसा आप लोग जानते होंगे, आज शहीदी दिवस है। और माननीय मंत्री जी 1857 में जो पहला स्वतंत्रता संग्राम हुआ था, उसके प्रमुख सेनानी, उसके प्रमुख नेता राजा राव तुलाराम सिंह जी के वंशज हैं। राजा राव तुलाराम सिंह जी को हरियाणा राज्य में राजनायक जाना जाता है और हमारे लिए ये सौभाग्य है कि आज उनके वंशज के कर कमलों द्वारा आज ये पुरस्कार प्रदान किए जाएंगे। तो मैं माननीय मंत्री जी से निवेदन करती हूँ कि कृपया आप मंच के सामने आकर, और सभी से मंचासीन कि आप मंच के सामने आकर हमारे पुरस्कार विजेताओं को यहाँ पर आज सम्मानित करें। May I request you, Honorable Minister, sir. So we are going to be presenting and celebrating success here, presenting the awards. And in the very category of community-based health solution, the runner-up, ladies and gentlemen, is Wipro GE Healthcare Private Limited. Would like to invite Chaitanya Sehrawat, and who's the CEO India and the President South Asia Wipro GE, to please join us here in accepting the award. Their project impacting NCD outcomes at scale through Project Screen that strengthen capacity to reach everyone for effective screening to prevent NCDs. In this very category, ladies and gentlemen, the next runner-up is MSD for Mothers India. Inviting Ms. Pompi Sridhar. The project Manyata, Public-Private Partnership, Health Service Delivery, Primary, Secondary and Tertiary Care, Maternal Reproductive Health. That's the area of the project. Still in the community-based health solutions, the runner-up, ladies and gentlemen, Tata Memorial Center, Mumbai. We have Dr. Sharmila Pimple, Professor and Physician, Department of Preventive Oncology, Tata Memorial Center, Mumbai. The project, access to affordable cancer care for one and all. The area of the project, public-private partnership, health service delivery, primary, secondary and tertiary care, and public systems strengthening. And now, ladies and gentlemen, in the community-based health solutions, the winner, Child in Need Institute, CINI. The project, Suswasthya. Would like to invite Dr. Indrani Bhattacharya, the Chief Executive Officer, CINI. Suswasthya, ladies and gentlemen, the project strengthening health and nutrition services for women, children and adolescents in Koirasol block of Birbhum, and upscaling the best practices in other 18 blocks to capacity building and advocacy. Working in the area of maternal and reproductive health, adolescent health and child health. My team members are there, so I just want to they actually make this possible. So many congratulations to the entire team making a difference at the ground level. Thank you. And now, ladies and gentlemen, in the category of COVID-19 preparedness and resilience, the winner, Jivika Healthcare. We'd like to invite Mr. Jignesh Patel, the founder and CEO of Jivika Healthcare. The project Jivika reached out to the underreached through COVID-19 mobile vaccination clinics. That's a vaccine on wheels in the area of public-private partnership, health service delivery, primary, secondary and tertiary care. And in the category of environmental health, the winner, ladies and gentlemen, is NTPC Limited. Inviting Mr. Dilip Kumar Patel, Director HR, NTPC. The project worked on the revival and the operation of municipal solid waste, the plant at Karsada, Varanasi. It's a project in the area of water sanitation, hygiene solutions, communicable diseases, and solid waste management. Many congratulations to all the awardees और माननीय मंत्री जी का बहुत बहुत धन्यवाद इन पुरस्कारों को प्रदान कर सभी को सम्मानित करने का। और अब मैं उनसे निवेदन करना चाहूँगी इस सम्मानित सभागार को संबोधित करने के लिए।
Fellow speakers on the dais, Mr. C.K. Misra, Sardar Daljit Singh ji, Mr. Siddharth Bhattacharya ji, Mr. Ashwajit Singh, distinguished participants, ladies and gentlemen, may I begin off by saying that this is an initiative giving awards for excellence in healthcare. This is an initiative that I'm really happy to be associated with, and I'm really happy that I've been called upon here to give the awards away. And being in charge of CSR in a small way as a junior minister in corporate affairs, I know how CSR has developed over the last 7-8 years. The new Act of Companies Act passed by Parliament was only passed in 2013. And CSR activities got underway a couple of years down the line. It wasn't until COVID really affected us as a nation, or the world was affected by COVID, that CSR activities in healthcare began to show results, and positive results at that. And Nathealth, healthcare, a company that's been incorporated, or rather a society that's been incorporated only in 2012, has made great strides over the past 10 years. So let me begin off by saying that those who associated with the incorporation of the society, who were its founder members, those who are its former presidents and those who are its present presidents and office bearers, they must be congratulated on taking up a very important issue regarding health in this country. Maybe they need a little bit of applause. And giving away awards, and this is only the second award, I must also congratulate the jury that has gone into depth to ensure the winners, the runners-up, and so on. They are eminent personalities, both national and international. Their body corporates who were on the jury. There were NGOs, I would think. And all told together, it has come about that the second award will be a benchmark for further awards in the future. I, being a sportsman, I know that if you win the first time around, it's God's gift to you and you become complacent. But if you have to achieve a win through hard work, then you can savor it better. So those that have won awards today, I congratulate them because the jury was impartial, I believe. And those that have also participated in these 4 verticals, the 63 applicants, health, technology, innovations, community-based health solutions, environmental health, and COVID-19 preparedness and resilience, who have not made the award as yet. Maybe in future years, you will be able to make it so, as long as you keep your hand on the plow. Coming to COVID-19 and the vaccine, I would like to say a couple of things. I don't know about the other 4 districts that Nathealth chose in the eastern part of the country, but I do know about Mewat. It happens to be a part of my constituency. It's a minority-dominated district, right in the shadow of Delhi. And when COVID-19 came about, if you recall, there was a seminar of all these religious preachers who came from all across Southeast Asia to deliver lectures on how Islam is to be taken forward. And this seminar was in Delhi. And as there was a bit of a resistance to these teachers coming and preaching a foreign religion in a country which is majority-wise Hindu, the first things that I found in those days was that the media had taken it upon themselves to say that these are the gentlemen who have spread COVID-19 in India. Because this congregation, when they dispersed from Delhi, they went all over the Mewat area and started preaching their religion, which is allowed under the constitution. What happened thereafter is what you need to know. That amongst all the districts in Haryana where COVID-19 was prevalent, the minimum amount of fatalities, the minimum amount of people who got sick with COVID-19 was in Mewat. So there was this inherent bias which the Mewatis thought was against them. And this win with vaccines, this initiative that has been taken by healthcare, this Nathealth healthcare, I know the positive results of that. And difficult as it was, they have succeeded in ensuring that people in Mewat took this vaccine not only for themselves but even for their wives and for their 18 years and above children. So this is something that they need to be congratulated about, and I congratulate them because I know this from personal knowledge. If I may digress a little more, every cloud, they say, has a silver lining. Now, COVID-19 affected the world. I don't know where it germinated. I don't know how it spread. If I have an opinion, I'm going to say it. But what I do know is that these 3 years, 19, 20, 21, when COVID was prevalent all over the world, there was a silver lining for India. India, which was earlier considered a third world country, aspiring but not having reached anywhere, especially financially, we were looked down upon. Today we are the 4th largest economy in terms of purchasing power parity. But people are not willing to believe it. But what has established India as a superpower, rubbing shoulders with other superpowers, and perhaps going further than them, is the COVID-19 vaccination program. Not only were we able to manufacture enough vaccines for our own population, 95 crore plus injections were given in those 3 or 4 years, but we were able to export it. And we were able to export it to countries which were being pressurized to even sometimes part, not with money, which they possibly didn't have because they were third world countries, but with part of their land holdings. The sovereignty of a country was being exploited by those corporations, and if there's somebody here, maybe I'm wrong, but this is what I have been told. There were certain countries in Latin America, there were certain countries in Africa, where those that held the vaccine and had developed the vaccine, they asked exorbitant price for giving this vaccine to those countries and the poor in those living in those countries. And when you compared that with what India did, at one hand you had people demanding that you give us a parcel of your land, you give us a parcel of your economy, and only then we will give you the vaccine. You will ensure that we are not brought to courts. You will have to give a guarantee that if something happens, we will not be brought to task. India, on the other hand, was supplying these vaccines free of cost. And the image that India has today, I would say, is predominantly because of the works, the social work that India and its corporates and its vaccine manufacturers were able to achieve during those 3 years when COVID was a big cloud on our heads. And so that is the silver lining, I think, predominantly through a partnership between the government and the private healthcare entities. So today, when I stand over here and SDG goals were discussed here, I would say that the goal number 17, this partnership between the private sector and the public sector, has gained dividends for India which probably were not achievable had it not been for COVID-19 having come upon our heads. So I congratulate both the ex-representative of the Health Ministry here and the present representatives of the private sector over here. And I'm told that today, well, it's the year, if I recollect correctly, 21-22. 35.8% of COVID spend was spent upon healthcare, which is a sizable chunk. And as you all probably know better than me, that CSR activities is a board-driven exercise. We have given the liberty to the board to take a decision as to where all they should spend this 2% of their profits over the last year. And possibly because of that, and possibly because 36% of the private sector CSR funding has been spent on healthcare, today India has become a hub, a health center, where people, not only from developing countries, not only people from oil-rich countries, not only people from developed countries who cannot afford and who have not insured themselves adequately, come to India to get treated for various diseases. And this is something that is going to project India's image in the United Nations quite considerably. So in that sense, today, I'd like to wind up by suggesting that this initiative of Nathealth Healthcare, second award ceremony, should be continued forward. Possibly those that have not participated, they can be invited to participate. 63 is a large enough number of people who have participated in these 4 verticals. But maybe we can achieve a target of even more for next year around. And as far as the government is concerned, I mean, the government by itself is an entity which people have begun to expect a lot out of. And over the years, we have even said, we'll provide you this, we'll provide you that, we'll provide you this, we'll provide you that in your house, etc., etc. Even give freebies also sometimes. So people have begun to expect a lot more than the government can deliver from out of the limited funds that they have. And the government cannot, and the nation cannot progress unless there is a partnership between the private sector and the public sector for certain fundamentals. Bring the economy up, bring the health up. So these are things that are being addressed today in this meeting of minds. And I thank you all for having called me over here, and I congratulate the winners. And maybe next time those that have not been able to make the mark, maybe they will be able to make it next time around. Thank you for all your time, ladies and gentlemen.
Thank you very much, Honorable Minister, sir. We really value your insights and your views and complimenting everyone, not just the winners, but all who were part of who sent in their nominations. If I can put it into a little bit of rhyming, it's good, better, best, never let it rest till the time good becomes better and the better becomes best. And even if it becomes best, don't be complacent, let the momentum be on. So thank you very much, sir, for inspiring everyone. And I would like to now invite all the awardees also to please join us. Please join in with your trophies. We'll have a group photograph with the Honorable Minister. I would also like to request the President Nathealth, the past presidents Nathealth, the LT members, Anvisha from Nathealth, Seema Gupta from CKD. May I request you all to please join. And do we... And also all the jury members who are present with us, they're requested also to please join. We'll have a group photograph. Thank you, and once again, congratulations. We would also like to apprise the Honorable Minister, sir. Sir, on behalf of all in this session, we would be going to be planting 50 trees. Nathealth is going to be planting 50 trees. That's a commitment which comes from Nathealth towards keeping the Mother Earth more prosperous, our contribution towards environmental sustainability. Thanking once again each one of you for being a part of this award ceremony. Thank you to Shri C.K. Mishra ji. And thank you to all the jury members going through all these 63 nominations and then selecting the winners here. thanking CKD, especially for this session. They have been the session sponsors and again the various nominations which we had received. Thanking them for partnering with Nathealth. So thank you, ladies and gentlemen. With this, we break for lunch, 1 hour break. 2 o'clock, we are going to be starting with the next session. That's on patient safety. Once again, I esteem thanks to all the sponsors for the support which they have extended in organizing this summit. Congratulations to all the awardees. Please, let's celebrate your success over lunch and requesting you to be back for the next session. For the patient safety session, we also have the Innovation Hub, the startups, and that's in the Regency 4 and 5. Kindly pay a visit there also. Thank you.